My name's Clare Healy. I'm a GP in Christchurch. I have had an interest in family violence for more than 20 years, and I'm very pleased to be involved in Project Atawhai, which is a 3-year research project taking place in the Bay of Plenty. Project Atawhai is seeking to make it easier for primary care professionals to respond to whānau experiencing or using violence. From a GP perspective, for participants who are working in general practice, I think it's a wonderful opportunity for them to self-reflect on their practice in this area of healthcare. Particularly, they may think about some of the barriers to asking patients about family violence. That might be lack of confidence or lack of knowledge about what local services are available and who does what. Sometimes it's about, in a busy general practice, being concerned that you haven't got enough time to talk to patients about this topic, or else that you're going to be opening Pandora's box and not able to cope with whatever comes out. Sometimes it's about unresolved personal history of abuse, and so you feel uncomfortable asking about it, or you feel you might be triggered if you raise the topic. There are also a lot of common barriers to disclosure by patients, and it's worth reflecting on those and learning from others about how they may be addressed. So patients likewise have a lot of reluctance to disclose about their own life experiences, particularly because for many patients, they want their doctor to think well of them. They want their doctor to think of them as competent and capable human beings, and they feel that by disclosing what's happening to them in the family violence area, that their doctor may think less of them. There's another real fear that if they disclose experience of violence at home, that there may be a risk of having their children taken away from them. It may be that they think it's not a medical problem. So in Project Atawhai, there's an opportunity for GPs to learn from their colleagues and peers who are working in the area to reflect on some of these issues and perhaps feel more confident using the skills that they gain in their general practice. So hopefully, as part of the project, they'll learn that family violence impacts all members of the family and that harm can be past or present or in the future. And that by asking somebody about their life experiences, you're not assuming that that's what their experience is or accusing them, but you're just trying to understand what's happened to them in their lives and travel alongside them, offering support and ideas of potential help. The other thing that may come out of Project Atawhai is the ability to deal with uncertainty and not be afraid of traveling alongside your patients in the context of some uncertainty. So overall, Atawhai is trying to make this work much easier and enable practitioners to work effectively together in primary care.